bribe. At the HHS, we executed a Freedom of Information Act request, and we struck gold. There were over 1,400 pages between our government and an institution that controls 60,000 OBGYN doctors. And in fact, what ACOG did was accepted millions of dollars, and they were not allowed to deviate from the lethal HHS narrative. And they had to push that it was safe, effective, and necessary in pregnancy. And they, in essence, gave up their own independent sovereignty in terms of making their own decisions, along with 60,000 OBGYN docs. There's the article you have on screen. And so, in essence, they were bribed. And then, of course, the American Board of OBGYN colluded and then threatened statements that they will, anybody that misinforms, according to their definition, in other words, questions their data, they get their state licenses removed. They documented, they linked the Federation of State Medical Boards, and what every physician works for their entire life is accreditation from their board specialties. They will revoke them.
All right, doctor, let's talk about the persecution of the doctors and the nurses. And it's the same in Australia, the same in the U.S., same here. It's all UN coding, we know. We had a whistleblower on yesterday that was a big coder. And I looked it up. I mean, it's true since 1948, the UN controls the codes. They control what you can do, what you can't do. If a doctor does what he knows is right or she does what she knows is right, they come after you. But this is the same thing we see in the congressional 800-page report that came out last week, where most of the focus of the censorship was not even election meddling. It was blocking doctors and scientists and blocking peer-reviewed studies that were on X and Facebook and other places. The federal government saying, take this down. And so you're talking about the federal government and other groups coming in, to the medical watchdog groups and telling them what was reality when it wasn't, and then controlling the narratives. It was a unified front.
That's absolutely right. Absolutely right, Alex. And what they did was they perversely and pervertedly, they invoked and created relationships with private entities, which are highly illegal, by the way, because they took away the First Amendment rights of those mine and 60,000 OBGYN doctors and threatened them if they spoke the truth. So any innocent pregnant woman who went in for her first visit in the most important medical visit, the most personal exam room, intimate exam room, discussing everything, the first baby, a pelvic exam, and they were trusting their OBGYN doctor. But their OBGYN doctor, what they didn't disclose to this lady is they were an agent of the state. They weren't acting independently and giving their patient, Mrs. Smith, honest information. They had to parrot false misinformation, push the vaccine in pregnancy, and if they didn't, they would be fired from their employer, and they may lose their license, and they may lose their accreditation. Alex, this is what happened. This is how it went down.
Well, doctors, tell the story, but let me just go back for a moment. I'm not a doctor, but my dad is a doctor, and I read the news for 30 years on air. Until 4 years ago, you never gave a pregnant woman any shot. Like you said, they don't eat shellfish. They don't eat raw honey. Suddenly they go, no, it's totally safe. I saw headlines. It's better for pregnant women. Pregnant women should take, I saw the headline, pregnant women should take double the shot. I mean, no science, no nothing. Guys, pull that up. Pregnant women should take double the COVID shots. I remember that like all over the news 3 years ago with an experimental shot. And then we'll get into, after you finish that, sir, your point. Now the numbers of the miscarriages, the numbers of women getting sick, the numbers of the babies that are born that have problems that they can't deny. So you're telling the first part how they suppressed you and others, or tried to, and now the carnage that ensued. Talk about raping of the Hippocratic Oath of Hippocrates.
Yeah, well, there's really three incontrovertible sources of data. Come from three separate sources, Alex. Number one is the mandatory legal 12-week rollout, Pfizer 5.3.6, by every government. The government mandates every company review the first 12 weeks of adverse events. And they had that available to them in February 28th, 2021. It was actually 10 weeks of data. And there was the most colossal injury and kill rate of any other drug in the history of humanity. On that first 10 weeks, there were 42,086 casualties, including 1,223 dead on page 7. Listen, this is the most lethal and injurious drug ever rolled out. And if you calculate the injure to kill ratio, it's unprecedented in warfare and medicine. The injure to kill ratio of that first 10 weeks was 33.4. What does that mean, Alex? That means for every person killed, there's 33.4 times that injured. And many of these are severe injuries. And then on page 12 of that document, it details the outcome of women who were pregnant. Pregnant women weren't even supposed to be receiving this. So it was a horrible, catastrophic outcome. There was an 81% miscarriage. There was a 5-fold increase of fetal death. There was an 8-fold increase in neonatal deaths. And there were major breastfeeding complications in those babies whose mothers received the vaccine. Now, what did the federal government, what did Biden do with that? What did the chief executive director, chief of staff, Jeffrey Zients, Vivek Murthy, the Surgeon General, then head of the NIH, Francis Collins, what did they do with that, Alex? Did they tell the American people what Pfizer's own data showed?